Hello, how are you today?
I'm fine, thank you.
Can you please state your name?
I'm Dr. Henry Parfit.
Okay, and what date did you have the balloon sinuplasty procedure performed?
That was in April of 2014.
Okay, excellent. How did you feel prior to the balloon sinuplasty?
Well, actually, the only problem I had with my sinuses occurred when I was scuba diving, and I've been a diver for 40 years. I had some problems in the past, had traditional sinus surgery back in the late 1990s, worked very well for a while, and then I began to have more problems with my sinuses.
Okay.
When you dive, there's a tremendous pressure change as you go down, and you can feel it in your ears and sinuses. People, when they fly on an airplane, when they descend prior to landing, can feel it in their ears and sometimes have to blow some air into the ear to relieve that pressure.
Exactly.
Very similar with diving. The pain from the sinuses can be just so bad that you have to abort the dive. And of course, that's no fun sitting on the boat when your friends are out diving.
Right, exactly. Now, as far as how long did you suffer with the symptoms? All the years that you've been diving, I imagine.
Well, it had gotten better after the traditional surgery, and then that held up for a good 15 years.
Okay.
And so when I came in to see Dr. Wiggs, I'd been having problems off and on for several years.
Okay.
Especially on the trips where I was on the boat for a full week and diving 3 or 4 or 5 dives a day.
Okay.
It was getting to the point that I was missing half my dives.
Wow, okay. So now, how would you say that the procedure that you had done has affected your life?
Well, it's just made diving a lot easier and a lot more pleasant, and now I can dive more freely. In the past, I would have to take some steroid medication to help keep
Wow.
the pain from occurring. Would actually maybe have to sit out a couple of days until the medication took effect. And as an example, I was diving in California last month, so on a boat for 6 straight days and never had to take any steroid medication.
Excellent.
So that was a big change.
That is wonderful. So are you happy that you had it
Very
done?
happy, absolutely.
Of course. Do you wish the balloon sinuplasty procedure would have been available to you sooner?
Sure, I wish it had been available sooner. I wish I'd known about it, but I'm just glad it came along when it did.
Great. Would you recommend this procedure to a friend or a family member?
Absolutely. It's a safe procedure, it's effective, and it can be done here in the office. A little numbing up seems to work fine.
Excellent. Are you happy with how the staff at Fayetteville Otolaryngology took care of you during this procedure?
Sure, the staff was great. They were very supportive, and highly recommend the practice.
Excellent.
And Dr. Wiggs.
Excellent, Dr. Parfit. Thank you so much for your time today.
You're welcome.